Hi, it's Brad Perriello here from Mass Device with Jeff Burbank, the CEO of NxStage Medical. I wanted to start by asking you about the origins of the company. You're the founder, still with it as CEO, and I wanted to get a sense from you about how you knew it was the right technology at the right time to branch out on your own.
Sure. So, NxStage is about 14 years old. I founded it and had been in the industry for about 12, 15 years before that. So, was knowledgeable about what was going on in the kidney failure space, end-stage renal disease area. And there were some trials that looked at whether frequency could benefit the patient versus the traditional 3 times a week in-center dialysis. And it really looked like there was some interesting data coming out that if we could give the patient either longer duration or more frequent therapy, that they could derive some really significant clinical benefits. But that wasn't going to happen in a dialysis center. So patients were going to spend 6 days a week or 7 days a week in a dialysis center. So it really needed the convergence of a therapy that could move to the patient versus the patient going to the therapy, and then the ability to deliver more frequent. So it was really the inspiration of the clinical data, and then some technology vectors came together with electronics getting smaller and less costly, with fluidics improving. So the perception that you could put something that stands this tall, weighs a couple 100 pounds, that has a lot of infrastructure into a portable, easy to use, easy to learn, safe system started to make some sense from a technological and clinical perspective. So that was the vision. It's rare that the vision aligns well to the execution. We actually have done all that now, and even got to the point where we've proven some of those clinical benefits and shown that we can reduce mortality with a more frequent home therapy provided by NxStage. So it's been very exciting.
What's the differentiator for your technology from the fairly large competitors that you swim with, Baxter, Fresenius, and others?
Yeah, I think one of the things that intrigued me was, you can't take big competitors like that square on. And it seemed that for home hemodialysis to really work, the technology had to be fundamentally redesigned. And my experience is that a different kind of business structure can be very helpful to that process. So we were venture-backed. We were a focused entity. We didn't have product on the market. We could focus exclusively on technology development and do it in a different way than the incumbents had. So we saw this crack in the market where nobody could jump into it without going through the process of development. And we ran first. There were probably 3 or 4 other companies at the time that were chasing the same opportunity that we were. They are not here, we are. So we're the ones that got through that and continue to lead the market. So we had a first mover advantage, and we keep extending that benefit as we go.
Jeff, reimbursement's been a difficult issue for you over the years, and I was hoping you could give us some color on what it's been like to ride that roller coaster.
Sure. So, I can have a lot of emotions about CMS. On the one hand, we're all taxpayers, so we want them to be really prudent stewards of our money. And on the other hand, we have a therapy that I think is superior for many patients, or the patients that want to do it. And I'd like to see appropriate reimbursement in place so that those folks that want it have access to it. And economics drive a lot of access and availability. So the unique thing about this space is the end-stage renal disease program is a very specific program. And in fact, it's one of the most advanced programs within CMS, because regardless of your age, if you have end-stage renal disease and you don't have insurance coverage, the government will step in and pay. So it is universal coverage. It is an entitlement, and that's a great thing. But because of that, CMS is the primary payer, and CMS is going to be very conservative. So the burden of evidence is very high with CMS to routinely cover. Now, with that said, CMS has provided a vehicle to create reimbursement or provide reimbursement for more frequent care. They do it, however, through a medical justification process. So it's a little more burdensome and less predictable than we'd like. So we'd like to see progress there. And in fact, essentially all the private pay have moved to usual and customary payment for NxStage therapy, more frequent therapy, and that just occurred in really the last 12 months. So we're very excited about that. We still have some work to do with CMS. They are paying, and we appreciate that, under the medical justification process, but that's more burdensome and less predictable for providers, so they're at risk that they shouldn't be. When the clinician thinks it's the right therapy for the patient wants to do it, reimbursement should be provided routinely for it. So we've got some progress to make there.
Jeff, as the founder and still CEO of NxStage, what are you most proud of with the company?
I think the one thing that people get really excited about NxStage is the impact on patients' lives in home hemodialysis. In fact, today was a very unique day. One of our employees came back to my office and said, "Do you have a minute?" I said, "Sure." Walked out to the front, and a patient that couldn't get therapy at their center looked up our address, drove over here, and he and his wife came into the office and said, "Can you help us get on your therapy?" So it's just so life-changing for people. We need to work on access. We need to create the opportunity. They were at a particular provider that didn't offer it at their center, so they were trying to find ways to get on the therapy. That's the kind of passion that a better therapy that can make patients live longer can drive. So it's very exciting. You can see as you walk around the facility, you'll see folks that are pretty passionate about what we do and the benefits we can bring to patients.